Yes. So I'm gonna let David speak to that in a minute, but just in general, yes, this is the crucial week because the incubation period of the virus is 14 days, and so this week we will be following things closely as we anticipate some revisions in the health directive. I'll let Mr. Sweat add to whatever he wants to on that.
Yes, I agree with Dr. Randolph. This is the crucial week, at least as far as evaluating the impact of Labor Day. We are now 1 week out, and we know the normal incubation period for COVID virus is 5 to 7 days, but it can be out to 14 days. So now that we're 7+ days away from Labor Day, this would be the week that we would begin to see an increase if there is going to be an increase occur. The reason we're worried about that is following the 4th of July, we saw a large upsurge in cases, and in fact, the month of July represented the high water mark of our epidemic so far. Now, we're watching 4 things. First is the reproductive rate of the virus. Does it stay below 1 or does it go back above 1? That's the first. And we did see that we had been running around 0.82 to 0.85, and now we're up to 0.94. So that is a measure of increase, but we approached 0.94, 0.95 once before recently and then saw it decline. So, we'll be recalculating that by the end of the week, and we'll know whether we went above the 1 threshold or we stayed below. So that's one of the things we're watching this week. The other is the number of cases reported. We've been averaging 121 over the past 7 days, but we had 213 yesterday. If we have multiple days this week with 200 or more cases, that would be a departure from the prior downward trend. On Sunday, we saw an increase in hospitalizations by about 20 some odd individuals. We also saw an increase in the intensive care unit. So both the hospitalizations overall and the ICU hospitalizations had been on a downward trend, and then Sunday they both went up. So that's the other thing we'll be watching this week is what's going on in our intensive care units, what's going on in our acute care bed hospitalizations, and then, as I said, the case counts overall, and the RT level, and then the positivity rate as well. That's something that we always monitor. So those are the kinds of things we're monitoring right now. Yesterday was the first data point, but by Friday we'll know more whether any of these upticks that we saw on Sunday and Monday were just a blip on the radar and then the downward trend resumed, or if they were the beginning of some new trend. And it's only going to take more data coming in to know the difference.